Welcome back to the deep dive. Today we are tearing into a system that is, well, one of the most frustrating and persistent bottlenecks in modern medicine. We're talking about healthcare referral management.
Mm-hmm.
I mean, if you've ever been through it, you know that exact moment.
Mm-hmm.
Your doctor says, okay, you need to see a specialist, and they say they'll send the referral over.
And then
Nothing.
exactly silence,
Yeah.
weeks can go by and you're just left wondering, did the fax even go through? Does the specialist's office even know I exist? And that feeling of being completely in the dark, that's where care just stalls.
And that void, that's precisely the gap we need to talk about.
Right.
Because it's not just an inconvenience for you, the patient. It's a real problem for continuity of care.
So that's our mission for this deep dive.
Right. We want to understand the failures in these old manual systems and then look at how intelligent automated solutions, mainly voice AI, are basically becoming a required upgrade.
Okay, so what's the core idea here? The industry calls it closing the loop. The minute that referral is made, the communication just tends to fall apart. Patients get anxious because they have no idea what's happening.
And I imagine the referring doctor is also in the dark.
Totally. They often get zero feedback. They don't know if the referral was received, if an appointment was made, or if their patient ever even saw the specialist. And that really hinders their ability to coordinate care.
So we're talking about moving past, paper, phone tag, fax machines, and into a world of real-time updates and faster care. That feels like a huge leap. Okay, let's unpack this. How exactly does voice AI step into this administrative bottleneck?
Well, that's the key. It's not just about sending a message. It's about handling the volume, the complexity, and the real-time interaction that's needed.
Because right now it's just people on phones.
Exactly. Staff are spending hours, hours every single day just answering the same questions over and over. Did you get my referral? When's my appointment? It's a massive administrative weight.
I can just imagine the collective sigh of relief from staff when they hear they don't have to answer that same call for the 50th time that day.
Right. So the AI integrates directly into the referral platform and often into the EHR, the electronic health record itself. And that lets it open up this dynamic two-way communication at 4 really critical points.
Okay, so what's the first one?
The first thing happens instantly. It's the referral, acknowledgement, and confirmation.
Instantly, you said.
The second the system gets that referral, the voice AI kicks off an outbound call or a text to the patient. And, sometimes to the referring doctor's office, too, if they've opted in.
And that immediacy has to be huge for patient anxiety. Just knowing the process has actually started.
It changes everything. Imagine getting a clear automated call that says something like, "Hello, this is ABC Health System. We've received your referral to Dr. John for your cardiology consult and are processing it."
It takes you from uncertainty to, okay, it's in the system.
Exactly. And then it can even provide a reference ID, so there's a real sense of assurance.
Okay, so acknowledgement is step one. But then you have to actually schedule the thing. How does the AI handle that part?
That's the second mechanism. Automated appointment scheduling and notifications. The AI pulls that scheduled date, time, and location right from the system and delivers it, but it goes a step further.
How so?
It's intelligent enough to include specific pre-visit instructions. So if you need certain blood work, it might tell you about fasting or remind you to bring your insurance card or specific documents.
So it's not just a generic reminder, it's tailored.
Very tailored. So you might get a message saying, your appointment with Dr. John is scheduled for the 24th at 11 a.m. Please remember to fast after midnight and arrive 15 minutes early for check-in.
Which cuts out a lot of potential human error.
A huge amount. And that leads right into the third mechanism, which is automated reminders and follow-ups. This is a massive driver for the business side, because it's all about reducing no-shows.
Which I know is a staggering financial hit for hospitals.
It's huge. So these reminders go out at optimal times, 24 hours before, maybe an hour before, and they're often interactive.
What do you mean by interactive?
It'll ask you to confirm. You'll get a text like, "This is a friendly reminder for your appointment on date. Please confirm by replying yes." The AI then tracks that response and updates the schedule automatically.
So it's not just sending information out, it's collecting it back.
Exactly. And this can even extend to post-appointment follow-up, clarifying next steps, medication instructions, things that improve patient compliance.
Okay, that covers the outbound messages. But what if I, as the patient, have a question? In between those automated messages, that's where things usually break down.
And that is where the fourth mechanism, and really the true power of the AI, comes in. Status updates and alerts. This is where it stops being a messaging system and becomes an interactive agent.
Okay.
So if there's a delay, say with an insurance authorization, the system doesn't wait for you to call. It sends you an alert with an explanation.
Proactive, I like that.
But the real game changer is the interactive part. You can call in and just ask, in plain English, what is the status of my referral to Dr. Smith?
Yeah, and understands that.
It uses natural language processing. It accesses the live data, parses your question, and gives you a real-time, up-to-the-minute answer. It's not a pre-recorded message.
Ah, so that's the difference. It's not just an answer machine. It's a dynamic interface that completely replaces the need for a staff member to look that same information up manually.
That's it. It just automates that high-volume, repetitive task away. And if we connect this to the bigger picture, I mean, this isn't just a communication upgrade. It's a massive operational shift.
It really is. And for you, the listener, the reason to care really boils down to, well, better care for you and huge efficiency gains for the entire system.
Let's start with the patient.
The improved patient experience. We're talking about 247 access to information. When you're worried about your health, just knowing where you stand, that reduces so much anxiety. It builds trust.
And it leads to fewer missed appointments, fewer errors. It just smooths out the whole process.
And what about for the doctors involved?
Well, that's the other side of it. This strengthens the communication with referring physicians. The primary care doctor gets automatic updates. They know when the appointment is scheduled. They might even get a notification after you've completed the visit.
So they're not in the dark anymore either.
Not at all. It strengthens that coordination of care, which is, absolutely critical.
And then, operationally, the payoff must be immediate. The increased efficiency. Staff aren't stuck on the phone all day.
They're freed up. They can focus on higher value work like complex case management or issues that actually need a human brain to solve.
Let's talk about the money side of it, the ROI. You mentioned no-shows.
It's the most direct financial impact. Those automated reminders significantly reduce the no-show rate. That means clinician time isn't wasted, and that hits the bottom line directly.
And I'm guessing the AI is cheaper than hiring more staff to make these calls.
Much cheaper. It's a hugely cost-effective solution long-term. The AI works 247 on weekends, overnight, without needing extra staff. The labor savings are just staggering over time.
So you get better care, faster.
You do. You get a faster turnaround time. You're eliminating all those manual delays, the phone tag, the voicemails. Patients get seen sooner, and that leads to better retention. People stick with a system that's efficient and predictable.
And finally, you get better data from all of this.
Right. Better data and reporting. Because it's all centralized, you can track everything, you see what's working, what isn't, and you can identify bottlenecks in your process and actually fix them. So if the benefits are that clear, then this raises an important question. What hurdles must organizations clear to successfully implement this technology?
That's a great point, because this all sounds fantastic on paper, but I can't help but wonder, are we just trading one frustration for another? Instead of phone tag, I'm now talking to a robot when I'm feeling vulnerable.
And that concern is absolutely valid. It's probably the biggest adoption hurdle, and it points to the second key practice: personalization and empathy.
How do you make an AI empathetic?
The voice engineering has to be top-notch. It needs to use a warm, natural tone. The cadence has to feel human. If it sounds cold and robotic, it completely breaks the trust you're trying to build.
So user experience is paramount.
Absolutely. But even before that, the number one thing that makes or breaks these projects is data integration.
Meaning it has to talk to the hospital's main computer system.
Seamlessly. It has to pull and push data from the electronic health record. And these hospital systems are, well, they're notoriously complex and often don't talk to each other very well.
And if that integration is bad?
You get chaos. The AI tells a patient the wrong time for their appointment. It forgets a critical pre-visit instruction that instantly destroys all confidence in the system.
And of course, there are the legal and security issues.
Non-negotiable. That's the third hurdle. Compliance and privacy. We're talking about extremely sensitive health data, so you have to be compliant with HIPAA, with GDPR. Security has to be ironclad.
And this isn't something you can just set up and forget about, right?
Not at all. The final piece is continuous monitoring and improvement. You have to constantly analyze the data. Are your call answer rates good? Are no-shows actually going down? You need to get feedback from patients and doctors and keep tweaking the system to make it better. It's an ongoing process.
So when you put it all together, it really does seem like voice AI is moving from just a nice to have to a real necessity for any modern healthcare system trying to manage this referral process.
It is, and you see companies like Cabot Technology Solutions really driving this forward. They're on the front lines, building these systems that streamline communication, automate the busy work, and ultimately lead to much better patient outcomes. Closing that loop, it really is transformative.
So what does this all mean for the future of patient care? Where does this go next?
Well, if voice AI can manage the incredible logistical complexity of referrals,
Right.
scheduling, status checks, coordinating between different offices, then you have to ask, what is the next high-friction manual part of healthcare that's ready for a 247 automation revolution?
Outside of direct treatment, you mean?
Exactly. I mean, should we expect every routine follow-up question, every query about a prescription dosage to eventually be handled by an empathetic AI system, reserving human staff only for the most unique and complex medical conversations? That's the frontier we're looking at right now.